Good afternoon. My name is Topper Simon. I am part of the American Hospital Association, where the mission is to advance the health of all individuals and communities. The policy that I'm advocating for is the SAVE Act, which is HR 7961. This policy is intended to create a safer work environment for medical professionals as the COVID-19 pandemic has brought on increasing number of reports of family members or patients threatening and harming healthcare workers. This policy will bring on legal penalties for assaulting or intimidating hospital employees. This bill also includes enhanced penalties for the use of dangerous weapons that result in injury and acts committed during a public emergency, as well as exceptions for individuals who may be mentally incapacitated due to illness or substance use. There is also provisions in this bill that will authorize $25 million in funding over a 10-year period to reduce violence and intimidation in hospitals, and can be used for training, technology, and coordination with law enforcement. The pros of this policy is the pros of this policy that healthcare professionals are able to have policy in place that protects them when it comes to workplace violence. Other pros is that it will help hospitals lower the costs when it comes to patient and healthcare professional incidents, as hospitals will not have to kick out all this money that is required when healthcare professionals have to miss work or have to pay for insurance bills. This policy is important as it will put policy in place that will punish the population of individuals who normally harm or intimidate medical professionals. According to OSHA, 80% of violent incidents reported in healthcare settings were caused by interactions with patients, which is very alarming when it comes to healthcare professionals, as they provide all the care to patients, and most of the incidents between healthcare professionals comes from the use of violence against patients. The benefits of this policy will be healthcare professionals in the population, as they will be able to feel safer at work and are in a safe work environment where they can provide quality care to each and every patient. Individuals that will pay in this policy implementation is the individuals that knowingly commit acts of violence against healthcare workers. Health concerns regarding healthcare professionals is that they don't feel safe in an environment where they are coming to provide care, quality care for each and every patient. They feel as if they are not safe when they come to work, which is on us to make sure we address. This policy will improve health outcomes, as healthcare professionals will be able to feel comfortable in their own work environment and be able to focus on giving patients quality care. This policy has been introduced to the House Judiciary Committee on June 6, 2022. The policy area is crime and law enforcement, and the next step of this policy is to pass the House and be introduced to the Senate. After being introduced into the Senate, it will have to be passed by the Senate and be implemented made into a law. I feel that this policy is a great policy when it comes to trying to help healthcare professionals and make them feel safer in their work environment. I feel that if the person who's trying to provide these patients with quality care is not feeling safe in their work environment, then that's an issue, and that's something that needs to be fixed. And I feel that this policy is well suited to help the population of healthcare workers, and will help them if it's passed, where it'll be able to allow hospitals and other departments to create policy around this bill to protect the lives of healthcare workers. The senators that I am proposing this bill to, or advocating this bill towards, is Senator Tim Scott and Senator Lindsey Graham. Thank you. Y'all have a nice day.